up, folks? It's Christina, your pharmacist here, and today we're going to go over an issue that's commonly encountered in the pharmacy that can affect not only your work life, but your quality of life overall: insomnia. Insomnia is often described as a dissatisfaction with both the quantity and the quality of your sleep. It can involve falling asleep, staying asleep, and sometimes waking up early in the morning and not being able to go back to sleep. Today we'll go over some of the over-the-counter medications you can use to treat it. Something that all insomnia patients can use, regardless of your severity, is a principle called sleep hygiene. I'm going to provide a list below because the strategies are quite extensive, but this includes avoiding alcohol, nicotine, and caffeine after 7 o'clock, exercising regularly, and waking up and going to sleep at the same time each day. An approach to both short-term and long-term insomnia that's gaining quite a bit of evidence is called cognitive behavioral therapy. It either involves being one-on-one with a trained professional or doing an online course or using an app. It uses strategies of sleep hygiene, personal experience, as well as sleep education. I'll provide a link below that includes a little bit more information on it. It's quickly becoming a first-line approach for healthcare practitioners helping patients cope with insomnia. It may surprise you to learn that there is only one over-the-counter product used for sleep: an antihistamine called diphenhydramine. It's the product that's actually contained in Sleepy's, Unisom, Nitol, and many products that you'll see over the counter that are indicated for sleep. You might have heard of it under its more popular name, Benadryl, often used for allergies. The evidence for diphenhydramine is okay. There's quite a bit of evidence that it makes you drowsy, but the studies are somewhat lacking in showing if it improves insomnia over the short or long term. If you're going to use the product, use it about an hour to a half an hour before you intend to go to sleep, and watch out for grogginess the next morning. We also recommend that if you're using the product over 7 days, to follow up with a doctor. Next, we're going to move on to the natural products that can be used for insomnia. I'm only going to touch on 2 products, and they are the ones with the most evidence. The first one we're going to touch on today is melatonin. Melatonin is a hormone that's already found naturally in our bodies. There is an increasing amount of evidence, especially for melatonin in jet lag related insomnia as well as insomnia in the elderly. There's no concern with this one about next day grogginess, but it might cause a little bit of extra sleepiness or drowsiness when used with other sleeping medications. The pitfall of melatonin is that we still don't have the long-term studies that we would like to show how well it works. Additionally, like diphenhydramine, if you're going to be using this product for 7 days, we recommend following up with a healthcare practitioner. Valerian is another natural health product found on the market that's used for sleep. It works similar to some prescription medications, but it hasn't been shown to work as well as some prescription items or diphenhydramine. A catch-22 with valerian is that it can take a couple of days to several weeks to work, and we always recommend following up with a physician if you're going to be using it longer than 7 days. There are also some concerns about valerian and its impact on the liver over a long time. We don't have a whole lot of information yet, and while it looks fairly safe, again, we just recommend following up with a doctor. It's also worth noting that there's a number of medications that can cause insomnia, such as antidepressants, blood pressure medications, and amphetamines, so it's worth checking with your healthcare practitioner to see if you're on any of these and what you can do to kind of manage your insomnia along with these prescriptions. See your pharmacist or other healthcare practitioner today to determine if you have severe insomnia, short-term insomnia, and what the best approach for you is. I hope that I've been helpful, and if you have any questions or concerns, please comment below. And sweet dreams.